start with a new chapter, that is tumors of salivary gland. This is a very important topic, and almost every year a long question comes that define the tumors of salivary gland and classify them and specify about any tumor of salivary gland that may be either Warthin's tumor, that may be either pleuromorphic adenoma, or that may be either mucoepidermoid carcinoma. So we are going to start today with the basic knowledge of the salivary gland tumor, the common thing that will be applied in almost all the tumor, and some common questions that are merely asked in the NEET PG and are asked by your external in the Viva. So before going to start with the salivary gland tumor, I want to tell you about something more important about the parotid gland, sublingual gland and submandibular gland, and that is all about the salivary gland. So just within 5 minutes I will have a quick revision of your subsalivary gland. Okay, so let's start. See, when you are studying about the salivary gland tumor, you will be very much frequently studying in your books, and I will be using some important terms like major salivary gland, minor salivary gland, the nerve supply of the salivary gland. So please go back and read once the salivary gland and the parotid gland from your anatomy book. So just within 5 minutes, let's have a quick review on salivary gland. Salivary gland is a exocrine gland, means they have their own ductal system through which their secretion goes. Okay, there are two types of salivary gland, that is major salivary gland and the minor salivary gland. The major salivary glands are the three one, that is parotid, that is sublingual and the submandibular. The minor salivary gland are depending upon their location, that is labial, buccal, lingual, retromolar, greater palatine. These are the some minor salivary glands. So let's come to know about some cells that are present in the salivary gland. The cells are myoepithelial cells, acinar cells, serous cells, and so their name acinar salivary gland, serous salivary gland, mucus cell, that is mucous salivary gland, the mixed salivary gland that is having both mucus and the serous secretion. Okay, now come to the nerve supply, arterial supply and the venous supply. The arterial supply is the carotid artery, submaxillary artery, superficial artery. Then in the vein they will have the retromandibular vein supply. Then to the nerve supply, and this is most important during the time of surgery to preserve this nerve, that is facial nerve supply. And the branch of facial nerve, the terminal branch of facial nerve, to be more specific, the terminal branch of facial nerve supply the parotid gland. So this was all about just a brief review or quick overview of the salivary gland. So now let's come to our topic, that is tumors of salivary gland. In the tumors of salivary gland, just focus on what we are going to discuss is this salivary gland is very rare. The tumors of salivary gland are very rare tumors, and they are heterogeneous group, means they have different genus origins, and they are relatively uncommon. They are not common in origin, they are relatively uncommon in origin, and they have a great morphologic variation. So your external can ask from you, a tumor having great morphologic variation is, you will write or you will say your answer, that is, sir, it will be salivary gland tumor. Now come to the annual incidence. This is asked in the NEET PG 2012, that the annual incidence rate of the salivary gland tumor is, according to the Stephers, it is 1 to 6.5 per 1 lakhs of the person. ठीक है. Then it is asked generally the most malignant tumor of the salivary gland. That will be most malignant tumor of the salivary gland will be mucoepidermoid carcinoma. Then most common benign tumor. Remember the two words. Malignant is mucoepidermoid. M for malignant, M for mucoepidermoid. Then the benign, that is the benign tumor, most common benign tumor is pleomorphic adenoma, PA. Pleomorphic adenoma. Then the benign tumor is approximately 80%, while the malignant tumor is 20%. So, since this tumor is very rare, but in these two, since rare, but if the tumor happens, then 80% times there is a chance that it will be benign, it will be less harmful. But 20% time it can get converted into the malignancy, and that will be the malignant tumor. So, there are various types of salivary gland tumor. They are differentiated by their histologic pattern. Yes, the histological variation is very much in this tumor. The salivary gland tumor have a very much wide histological variance, and you will know that 2 to 6.5% of the head and neck neoplasm is the salivary gland tumor. Just 2% out of the 100, the 2% tumor, if in the neck and head, will be the neoplasm of the salivary gland. Now, the most salivary gland tumor originates in the parotid gland. Yes, out of the three major glands we have discussed, parotid, sublingual, submandibular, the parotid gland tumors are much more frequent, and the most commonly we will find that the parotid gland tumor are much more, that is approximately 64 to 80%. This you have to remember all the data because they are asked in the NEET PG. Then malignancy. The malignancy of the salivary gland will be 15 to 20%. The sublingual gland will be less than 1%. The tumors of sublingual gland will be less than 1%, means they are rarest of rare tumor. And the minor salivary gland like labial, buccal, lingual, greater palatine, retromolar areas tumors, they are 9 to 23%. That is, and one more important thing, the females are more commonly affected with the minor salivary gland tumor, and that having a ratio of approximately 1.2% to 1%. Means 1.2 to 1 is the ratio, means female are more commonly affected. In the SAFERS, there are two ratios has been written, that is 1.9 is to 1 and 1.2 is to 1. What it means? There are two frequency, there are two studies, and the two studies have shown that that is approximately 2 is to 1 is the ratio. Now, the site of salivary gland tumor, this is the site, and it will be written in every question. Your pleomorphic adenoma will have the same site, your oncocytoma will have the same site, your basal cell carcinoma will have the same site, your basal cell adenoma will have the same site. So you have to remember by heart the salivary gland tumor site. That will be the hard palate, the soft palate, the tongue, the floor of mouth, and the retromolar area, and the angle of mandible. Can you tell the most common out of it is the hard palate? Why this is hard palate? Just because the hard palate has more number of the salivary gland openings, so hard palate are more frequently affected with the salivary gland tumor. Okay, so come to the hard palate is much more common than soft palate, and the malignant tumor are much more in the, okay, one more thing, the malignant tumor are much more in the lips, tongue, floor of mouth, and the retromolar area. Can you answer why? Every time when you study, ask yourself why. Yes, so here the malignant tumor, I am telling you, the much more amount of the malignant tumor are in the lips, tongue, floor of mouth, and the retromolar area. Yes, it is just because there are much more amount of the blood vascular supply in this area. Since the blood supply is much more, and the malignancy has one very characteristic feature, that is metastasis. And if a tumor has to metastasize from one place to another, it will require what? It will require the blood area, or it will require a pathway through which it can go from one place to another place, and it can metastasize. Yes, the lips, the tongue, the floor of mouth and the retromolar area have higher frequency of the metastasis and higher chance of the malignant tumor. The most common among the children is, the most common tumor among the children is, yes, pleomorphic adenoma cancer. Pleomorphic adenoma is the most common, and they are most commonly seen in the children. Now, by heart you have to remember the rules of 80s. The rules of 80s are most important part, and you have to remember it by heart. So let's come to discuss about the rules of 80s. In the rules of 80s, that is 80% of the parotid tumors are benign. First, the 80% of the parotid tumors are benign. It is simple. Then 80% of the pleomorphic adenoma are from the parotid gland. Means 80% of the pleomorphic adenoma is in the parotid gland. Means parotid gland have 80% chance that it can have the pleomorphic adenoma. So two rules, that is 80% parotid tumors are benign, 80% of pleomorphic adenoma is in the parotid glands, 80% of the salivary gland tumors, 80% of the salivary gland tumors are pleomorphic adenoma, and they occur in the parotid. 80% of the pleomorphic adenoma are occurring into the 80% of the pleomorphic adenoma occurring into the superficial lobe of the parotid gland. You know there are two lobes in the parotid gland, superficial and the lower. So the superficial region of the parotid gland is affected 80% by the pleomorphic adenoma, and 80% of the untreated patient remains benign. Means 80% chance is there that if the 80% of the tumor, if left untreated, it will be benign in nature. Now come to the etiology of the salivary gland tumors. Please focus the etiology of the salivary gland tumor. I am going to rub it down. Okay, we'll rub it again. So in the etiology, you know the Epstein-Barr virus. Write it down. Epstein-Barr virus is the first etiology. It may can cause salivary gland tumor. Once the virus infect, it will lead to the tumors of salivary gland. Okay. Second, the occupation. If the patient who is having the salivary gland tumor is working in a region or working in a condition where the chances of salivary gland tumor is much more, can have the salivary gland tumors. So after that, like rubber industry workers, like the workers of the coal tar industry having woodworking, because they always consume dust, and once they consume dust, then different types of means every time the salivary gland is getting irritated, and the bacteria can damage that gland. So there is chance that the occupational hazard can also cause the salivary gland tumor. Then increased occupational risk, like the person having work in the asbestos, nickel or the silica dust area, means dust area where the patient is working can have the tumors of this gland. Then sometimes we know the salivary gland are exocrine gland. Sometimes happens is there is excessive production of the gland hormone. Once there is excessive production of hormonal gland, means the indigenous hormone which are present lose their control and coordination. Once the control and coordination is loose, means the body is not able to recognize the neural control and hence the tumor can develop. Then the lifestyle, like the Warthin's tumor, you know, and you will study in few lectures that the Warthin's tumor are occurring in the patient having a smoking tendency, and once you have a smoking tendency, means this is in the lifestyle. They frequently do smoking, and that is why they can get affected with this tumor. Then the ionizing radiation, they are the almost every time in any tumor, the ionizing radiation are the prime causes, UV rays, etc. are the etiological factors. So this was the introduction portion and the etiology of the salivary gland tumor. In the next lecture, we will start with the histogenesis, theories of the histogenesis, and will somewhat get an overview of the pleomorphic adenoma, the one of the most and highly asked question of the surgery and the oral pathology. So, till now, go and study the salivary gland anatomy from your anatomy book, and please do like, share and subscribe our channel Ocean of Dentistry for more updates. Hope this video was helpful for you, and keep us supporting. Thank you. That's all.